Duke-NUS class of 2011. Before coming to Duke-NUS, I was a life science student in NUS. I went straight to Duke-NUS afterwards. Yeah. Right now, I'm a second-year resident in Pediatrics in SingHealth in KK Hospital. I chose Pediatrics because it was in line with what I wanted and the kind of medical interest that it offered. How I chose it was basically we got our first exposure through our clerkships in second year. Pediatrics was actually my first rotation, and I enjoyed it. So I went to pursue electives in children emergency, and again I enjoyed it. So I decided I think somewhere in my third year that I was going to do pediatrics. So in my final year, I did a couple more electives in pediatric surgery, and also I went over to Duke in the U.S. to do a sub-internship in pediatrics as well as an elective in rheumatology. And basically how I chose it was I asked advice, of course, from teachers, from those who I knew who were already in pediatrics, and I compared my experience with pediatrics as well as my experience with the other specialties, and I decided that that was a specialty for me. So because we were the first batch, and at that point in time, I think the residency was only about a year into running, so there were definitely a lot of uncertainties on the process of application, the criteria, how they were going to choose us. But there were a lot of meetings with the pediatric specialties as well as the institutions, and we had faculty also who were in the specialties who we could consult. So there was definitely a lot of apprehension and questions. I think the requirements were pretty straightforward. In terms of recommendations, the essays that we had to put into and then also the interview process. What was probably more worrying was at that point we were not really sure of how they were choosing us, and also in the light that the residency was open to everyone now, basically. So the competition pool is bigger. So our primary concerns were that, as of the same as when you're applying for any other job, which is what are my chances? How am I going to increase my chances? And how will I make them pick myself over the tens of other applicants, with some with probably more experience than we did. Yeah. Match day, we had something on in school, and I cannot remember exactly. It was one of those things that you have at the end of final year, and they gathered us out. As we went out, they gave us all our residency matches envelope, and we opened them and we found out the results. I guess that's how we found. I mean, of course I felt happy. I got what I wanted. I got my first choice, so yeah. When you're a student, you have time dedicated for studying. You have schedules. You only have to worry about yourself. Of course, you do worry about your future and all. But when you're working, your world gets bigger. You have to, although you do experience working with teams at school. It's really different when you start working. So you realize how important relationships are with your colleagues as well as the other services. The job is, as a doctor, it's physically tiring and demanding. So when I was a student, all that I did was, most of the time was just to study. So when you're working, you're walking a lot. You're spending long hours. So that was something that I had to get used to. It was also tiring mentally, of course, because now you're dealing with real people, real patients, and you know, although you're just, you know, a junior officer, you know, their life and their health depends on, well, not depends on you, but you know, you can affect them. So that's an additional stress. Plus, even though you're working already, you're still a trainee. So you have to carve time sometimes out of your working hours to study and read up about your cases, so that you not gain only clinical knowledge, but you continue to solidify your basics and your foundation. So I think that's probably the biggest difference. Yeah. And yeah, so again, the working hours, it's really something that's that you really had to get used to. Yeah. We are required to do more supervision for the house officers, and you also assume more of a leadership role. So in terms of ward management, dealing with nurses, make sure planning for the patient's discharge, and also again to teach your juniors as well as your fellow colleagues. I think there's also more expectations in terms of clinical knowledge and skills, and also in terms of because now we have more time as medical officers, we are expected to read up and study more. Yeah. In second year, we were given ample opportunities to pursue pediatrics if we wanted to. So I believe that my second year clerkship as well as my subsequent electives helped me prepare, at least in terms of clinical knowledge and exposure to the clinical cases in peds. Doing the other specialties also helped because they hone your clinical reasoning. So I think in terms of basics, Duke-NUS did give us adequate preparation. I had the chance to be a sub-intern in Durham. And it's the same if you also do your sub-internship here in KK. So that's a chance for you to get used to the working style, as well as the common cases that you see in pediatrics. And especially if you do your sub-internship here in KK, you get used to the culture far easier, and you get used to the computer system. So these are actually important part of when you work. In addition to that, I think I'm very grateful to Duke-NUS for giving us a good exposure to ethics, as well as communication, because these are very important parts, especially in pediatrics, where we have to communicate with parents a lot, where we have to deal with anxious parents or parents who may have complaints. So we have, I think, through our 4 years of practice course, they have given us a lot of exposure and practice on how to deal this. I think we also have a very good foundation of professionalism, which is very important, and which we try to continue to uphold when we work. And finally, because Duke-NUS has a strong focus in academics, when we work here, we just don't work based in by following what people usually do. It reminds us our training in Duke-NUS in terms of academic medicine or evidence-based medicine reminds us to always try to find the logic of our management plans, and to always try to look for and apply evidence-based medicine in our practice. I guess that's how Duke-NUS prepared us. Yeah. So it's something that when you wake up every day, you have to feel excited about, and at least get motivated to go to work too. So it can be the clinical cases, the kind of diseases that you will see, or the kind of patients that you will have, or the prospects of research for that certain kind of area. So, and also it has to be something that's suited to your personality. So, and of course, you have to you have to look at it realistically. Is it something that you'd have a good chance of getting into? So I guess that's how I would look at it from a broad point of view. So if so once you have certain areas that you want to try, I would recommend getting electives, because there's nothing like getting firsthand experience on that area. Also talk to seniors who's done it before, and talk to the faculty too. You also have to offer something to the residency. So I mean, you know, of course you're a junior officer and all, but subsequently you will become part of the department, part of the institution. So I think the residency committee will also be trying to look at it at a long-term kind of thing. So if you can offer something more in how you can, if you can offer something to the institution, that will be something that they would look strongly at. So I envision myself to continue training. I would still be very much like to be involved in a public institution where you can teach. There's opportunity for research. So I guess in 3 years' time, I'll be a senior resident or registrar here in KK, hoping to have foray into research already, and would also be like to be involved in medical education. Yeah. Whenever you tell people you're from Duke-NUS, sometimes they take a second take or something like that. But I feel good. I feel that the school has prepared us enough. I feel proud of being a Duke-NUS alumni. I don't hesitate to hide behind other schools or what. But it's good. We are slowly forming our own community here in the hospitals as well. So there's a sense of solidarity. But also, we are quite good friends with doctors from other schools too. So, yeah. Be prepared for the medical world, because the medical education is just one part. It continues with training and working, so it's not going to be hard, but it's definitely exciting. You won't run out of interesting things in your life. For those who are planning to go to Duke-NUS, you'd be privileged to go in a school with a lot of prestigious teachers who are dedicated and committed to your learning. Also the staff. You'd be prepared to enter and learn in the Singapore hospitals, where there's a lot of interesting cases and a lot of opportunities for leadership and research. Certainly it's not without its challenges. We are a new school, but we are slowly making our mark. I guess now that there's already a few classes that have graduated, you'll have more people that you could ask questions and who could help guide you. So I say that it's going to be an interesting and exciting venture if you do decide to go into it.